Living Well with LDS Hospital.
Yeah, one of my favorite guests back on our show today, Dr. Brett Parkinson, and it's the right time for you to be on the show. October is Breast Cancer Awareness Month, and there's so much going on in this field right now. I know Saray just did an interview with you for our 4 o'clock news. The latest, Dr. Parkinson, on breast cancer research is what?
The latest is a possible blood test for breast cancer. At Intermountain, researchers have begun to look at the possibility of finding cancer in a blood test in asymptomatic women. Now, this is a 3 to 5 year study that we have embarked on, and we will be comparing the blood of women who are asymptomatic, who come in for screening mammograms, with those women who have breast cancer, and we'll see where it takes us.
This is incredible. So is this something that when people come in for their mammogram, they'll also be offered?
They will be offered to be in the research screening arm of the study, and we hope that we'll get a lot of support from the community with that.
So because it is Breast Cancer Awareness Month, I just called and signed up for my mammogram next week because it is so important. And for some reason, Dr. Parkinson, Utahns aren't doing this.
We usually rank among the bottom of the states in compliance. 65% of women or fewer are actually having a screening mammogram every 2 years, not every year, every 2 years, and those are eligible women. We recommend that women start screening at the age of 40 and screen every year for as long as they are healthy. Multiple studies have shown that the most lives saved happens when women screen every year. Now, different societies have different recommendations, but they all agree on one thing. To save the most lives, it should be yearly. Now, people are weighing things like anxiety, saying that it is a negative to mammography. Well, I don't think anxiety is really a sufficient reason to stay away from a mammogram. 10% of women will be called back, but over 90% of them will be told that there's nothing wrong. For every 1,000 women that are screened, 4 or 5 will have breast cancer. If you have a lump, then the odds are a little higher. But it's important that all women get screened because 1 in 8 of you will ultimately develop breast cancer, and it is curable. In 25 years that I've been practicing, I've seen the death rate go down by 40%.
Wow.
That's a huge advancement.
Incredible.
Well, what I think is so important is you're saying 40 years old, so I'm not quite 40 yet. But what are signs and things I should be looking for? Because I do have lots of friends my age who are having breast cancer. What should we be looking for?
Any woman that feels a lump or has any symptom related to her breast should contact her doctor and undergo a diagnostic mammogram or ultrasound. If you're under 30, we usually start with ultrasound. If you're over 30, we'll start with mammography. If you're asymptomatic, we usually start with mammography screening. And we have 5 screening centers here in the Salt Lake Valley. We have 1 hub at Intermountain Medical Center where we do the diagnostic work and where you can have your biopsy. It's very convenient for women, and so women should be able to have their mammogram close to home.
Well, and Dr. Parkinson, can we talk about that? Because you are at the Breast Care Center, state-of-the-art treatment there. Why is that so important?
Well, breast care centers are important because what we want to do is we want to focus our expertise in one area. And when a woman gets screened in our system, we take care of her. She will have her diagnostic workup. We can do her biopsy often the same day. We can send her to a surgeon, and we are going to discuss her at a multidisciplinary conference where all the experts convene to make sure that she has a treatment that is tailor-made to her tumor type.
So what I want to know is, we're saying Utah is one of the worst at coming in to get a mammogram. What do you want to say to the women out there watching who are having anxiety about it and not wanting to go? How can you help ease their anxiety?
First of all, most likely your mammogram is going to be normal. Of the 1,000 mammograms we do, 900 will be completely normal. 100 may have an abnormality on it, but when you come back and we do the ultrasound and we do the additional views, most of those women are going to be fine. But we're looking for those 5 women in 1,000 who have breast cancer. And if you are screened every year, your possibility of having breast cancer goes up as you get older. Because by the time a woman reaches 80, there's a 1 in 8 chance. And if you look at your family, your friends, you know women who've had breast cancer. The radiation is minimum, the discomfort is minimum. We now have 3D technology, so we're better at detecting cancers than we were. We also have supplemental tools like ultrasound and MRI. We are in a great position to find that cancer if the women will come in.
Go in.
Yeah. Save your life. We know
go in.
people who are in that 8 and who didn't make it. And really you are saving lives.
Right. One other thing is the American Cancer Society no longer recommends self-breast exam or clinical exam. At Intermountain, we still recommend that women examine their breasts and that doctor examine women's breasts, because half the cancers that we find are by the women or the doctors themselves, the other half on screening mammography. So those two things are important.
I'm going in 2 weeks. I want you all to go with me. Call the hotline right there on your screen to schedule your appointment, 801-507-7888. It is no thing. It takes a minute. Go in and save your life and get friends to go. Get friends to go with you. Call all your girls. Dr. Parkinson, thank you so much for being back on the show, and thank you for that update.
Yep.